MD Conference Live presents updates from the European Society of Cardiology in Barcelona.
Dr. Yusuf, thank you for being with us today. Would you please describe the rationale behind your study?
Well, the Active Eyes study was designed as a complement to therapies evaluating the effect on stroke reduction, antithrombotic therapy. In atrial fibrillation, patients have a high incidence of hypertension. They also tend to have a high rate of complications from heart failure. So this trial was using irbesartan to lower blood pressure and hopefully to reduce stroke and heart failure.
And what were your key findings?
Our key findings was there was a neutral effect on cardiovascular death, myocardial infarction, stroke, but there was a highly significant 15% reduction in heart failure hospitalization. There was a trend towards fewer strokes. Our blood pressure lowering was very modest, and the degree of blood pressure lowering was only 3 millimeters systolic, and we had about an 8% reduction in strokes, which is similar to what we had with reductions in TIA and peripheral thromboembolic events. So if you put it all together, there's a highly significant reduction in these events. There was also a major reduction in the number of days people were in hospital. So clearly patients were benefiting by this very simple therapy.
And what are the implications for clinical practice?
Well, so far, research in the field of atrial fibrillation has focused largely on antithrombotic therapy to prevent strokes, and that's a good thing. But I think what we are finding is that heart failure now is the commonest complication in atrial fibrillation, and this study suggests that irbesartan has a modest but clinically important benefit in people with heart failure. It also suggests that in people receiving antithrombotic therapy, there is a high risk of intracranial bleeds, and it's likely that blood pressure lowering using irbesartan reduces that as well.